good morning. My name is Camille Williams, and I am a healthcare consultant, and I'm also the Chief Operating Officer of ENT Associates of South Atlanta and Midtown Sinus Clinic in Atlanta, Georgia. Today I'm going to be talking to you about the digital divide or the digital drop-off, which is where a lot of practitioners and patients dwell. I think Kelly's presentation was especially well-timed because she talked about a lot of the patient issues that I've encountered as a consultant and also as a healthcare executive. But additionally, I'm going to go into some of the issues that I encounter with physicians. And that's a lot of fun. And actually, the lady who asked the last question about change management and changing behavior, you're going to get some answers. So let's take this ride. I changed my talk last night. Technically, I changed it at 3 o'clock this morning. It was a lot of fun. But what I realized is that this crowd is different than any crowd that I've ever talked to. I've attended Health 2.0. I've gone to Practice Fusion Connect. I've attended other tech conferences, and I've attended the American Otolaryngology Association meetings. So I've gone to doctor conferences, and I've gone to tech conferences. I've gone to patient conferences. This is the first conference I've been to where all of those worlds collide. And since they collide in me as well, I'm really happy to be here. In addition to all of those roles that I told you, I'm also a patient. I'm a patient who has a 20-year hospital history. I take lots of medications, and I'm hospitalized multiple times, and I've got a surgery list that would make your hair fall out. And I'm still here, and I'm still doing this thing that I love. In fact, it fuels what I love. I am obsessed with what I do. And what I do more than anything is I make marriages between technology and people, specifically people in healthcare, patients in healthcare who are already terrified, who are terrified of the unknown, who are trusting their bodies to physicians, and then physicians who are also terrified of the unknown, these rules that are coming down from the federal government that they don't understand in language that's too dense for even their attorney to explain to them, and their 5-year-old might be able to get it, but they don't. So I'm a little terrified sitting up here, but I'm happy to be here. So let's start about where I started. I built a surgical practice with a physician. It took about 5 years, and from the beginning, because I was a sick person, I had to start systematizing everything that happened. It couldn't be the way that they were doing things before with 10 employees handling various bureaucratic activities. I needed to have a computer that would handle all of the bureaucratic activities that I could monitor from home because I couldn't get out of bed most of the time. I needed to be able to monitor my employees and what their every activity was. Were they on Facebook or were they actually logging in a patient's information? And I needed to be able to do it from my office because I couldn't get out of my chair for 6 hours. The next part, after some surgeries, some drama, some money, I started being referred to other practices. They started hearing about me. I started being called the computer lady. So the computer lady drags herself out of the house, and she walks in. And I would tell every practice the same thing I'm about to tell you. We're going to do this in 4 hours, okay? 4 hours is about as long as I can stand up. So everybody's going to master this stuff, and you're going to get it quick, and you're going to love it. And they would look at me and go, we've already had 2 systems. We spent $150,000 on the first one. We spent $60,000 on the second one. The doctor can't type. The front desk girl started 2 weeks ago. The PA is probably quitting. We saw her resignation letter. And I'd say, none of that's a problem. Doesn't really matter. You're going to love this. Because this is what I specialize in. I specialize in the sexy and the beautiful. So what's sexy about technology? What's sexy is what it can do for you. The way everybody's heard of the 80-20 or 90-10 or 99-1, you know, however you want to splice it. Most of your time is spent doing tasks that are repetitive, that could be systematized, and that you don't need to be doing as a human being. So what if we use that computer, and instead of you being afraid that it's going to take your job, why don't we make that computer your fit bitch? Why don't we make it your bitch and make it do your work so that you can spend 80% of your time actually serving the patients that you're here for? What most people don't realize, and maybe some of the people in this auditorium do, is that most of medicine is bureaucracy at this point. Most employees in a healthcare organization are there to file paperwork, to generate claims, to chase money, and to deal with insurers. They are not there for the patients. The customer is the patient. But you know who the real customer is? It's the insurance company. That's the customer. So the insurance company is the customer. Give them the lowest paid employee, your computer. Give everyone else, the people with the pulse, the people who came into medicine because something happened to them or something happened to someone they love, and let them deal with the sick person at the counter who's freaking the hell out. Let the doctor do what they do best, which is parse information. Don't force what can't be forced. Kelly said that too. I thought that was awesome. So I'm going to give you a couple of quotes because I like them. One of the first parts of making technology sexy in healthcare is instead of going with what we might call a central model, is to go instead with a multiple source of innovation model. And that model explicitly recognizes that instead of simply accepting or rejecting an innovation as a fixed idea, potential adopters on many occasions are active participants in the adoption process. They struggle to give their own unique meaning to the innovation as it's applied to their local context. Now, you may hear about fixed multiple source of innovation models across multiple industries, but you know where I got this quote from? Agriculture. They were talking about farmers in impoverished lands who were being given technology that they didn't know how to apply until the people giving out the technology said, okay, we're gonna do something revolutionary. There's your technology. See you later. And 3 months later, they came, and the farmers had adapted the technology to exactly what they needed, and they were growing crops, and they were irrigating their land, and they were doing fantastic things. Well, that's how I bring sexy back into technology in healthcare. I walk into an office, I tell people what's going to happen, and then I choose the youngest, least experienced, probably poorest person in the room, and I ask them, how comfortable are you with technology? They look at me like, oh, she's talking to me. My next question is, do you have a phone? Yeah, I have a phone. Do you get on Facebook? Yeah, I get on Facebook. Are you on Facebook right now? Yeah, I'm on Facebook right now. And I tell them next, this is not going to be harder than Facebook. And they look at me, and they don't believe me. And then 5 minutes later, they're rushing through their electronic healthcare system, and they're saying, this is just as easy as Facebook. This is awesome. And I repeat that system with the back office people, with the nurses, with the PA, with whoever I can get my hands on. But there's one person I don't talk to, and that's the physician. I don't talk to the physician because I am engaging in a behavioral psychology experiment. I am seeing how long it takes for an alpha personality to break out of curiosity. And so once everybody has their new devices, and the nurse is sitting in the back, and she's charting on her iPad, and the front desk girl is typing up a storm, and the back office medical assistant is entering vitals like nobody's business, the physician finally says, well, when am I going to have my training? Today, sir, if you'd like. Or today, ma'am, if that's your pleasure, let's get this done. And this is the best part. This is the beauty of it. I walk in, and unlike with everyone else where it was a challenge, it was a game, and you mentioned play, and play is so important. Instead of making it work, it's play. Can you figure out how to do this? You don't need me for that. You're a brilliant person. With a physician, the stakes are higher. Everyone in their organization is already adopted. The front desk girl, who he knows has a GED and is probably his niece, she's adopted. So I walk into this person with a lot of education, and I tell them, you know, you're probably a lot smarter than me, and I'm pretty swift myself. And you're probably the smartest person in this organization, and I'm just going to guess, you were valedictorian of your high school class, weren't you? I get that laugh, yeah. And then I tell them, I'm going to log you in, and I'm going to tell you your login, and I'm going to do one walkthrough with this, and that's it. I'm going to see if you're as smart as I think you are. I have essentially double dog dared the person who's signing my check, who's signing the checks of everybody else, who's signing the check for the vendor, and within an hour, more, sometimes 4 hours, but that's stretched over days because they're really, really busy. I get a phone call, and they're asking some complicated, arcane question about the coding on the system and how they can subvert it so that they can, make it work for them, and can they do it on their phone? And I'm going, this is the same person who can't type. It's amazing what a human being is willing to teach themselves when they're playing. It's amazing what a human being is willing to learn when they think it's going to be fun. So, sexy, beautiful, fun technology. Finally, I want to leave you with one more quote. And this is where I think most vendors are failing. And I say fail, and I mean that in the most serious terms. They're asking physicians and their staffs to do something that is virtually inhuman. They're asking them to take the skills that are needed to listen to a patient's complaints, assess medical relevance, contemplate interventions, as well as type notes at the same time, which would require a significant level of concentration, typing skills, and familiarity with the application's user interface, not normally found in the most adept computer user. There isn't a programmer I have met in my life, including both of my fathers who are computer engineers, who could do what I see doctors do on a day-to-day basis and who could type it up at the same time while gathering information about the emotional state of the person in front of them, whether the person's had a bath, what their psychological state is, what their actual issue is, what their underlying issues are, what other professionals need to be involved in their care to solve their immediate issue and their long-term issues. We're asking not the impossible, we're asking the foolish of these providers. And we're asking the unimaginable of a patient population that has an implicit trust relationship with their provider, and you're violating it every time you ask a provider to do something as simple as go from eye contact to this. Thank you. Any questions? Pardon? Actually, I have a QR code that you can use. It's not on here. It actually works. But you can reach me at Camille at CamilleAWilliams.com or via Twitter at ShanghaiCamille. Yeah, that's easier, right? And I've been tweeting up a storm. So, I mean, it's not hard. Just look at the MedX hashtag. Any other questions? Shanghai Camille, like the city Shanghai. S-H-A. Here, you know what, Aaron? But I get your unicorn in exchange. Go ahead.
I was just wondering if you were connected. Because first you were like, give them the technology, let them play. But how do you go from that to mucoses, which is like you said?
I didn't say they go to typing. They go to figuring out how to make it work for them. So for some physicians, they're much more accustomed to dictating. Like surgeons are very accustomed to dictating because they dictate all their off notes. So they get dragon dictation, or they dictate into their system, or they dictate into a recording device and they send it off to a transcriptionist. And they're very happy to pay for the transcription service because it gives that fast turnaround and they're able to give patients a much more present experience. They're able to be present for their patient because they can dictate as soon as the visit is over. And they have excellent recall. There was another question. Yes, ma'am.
I just wanted to comment, and that is in drawing information we heard this morning and yesterday about expertise and empathy, the operant phrase. I personally do not feel empathy when somebody is typing and not looking at me. So if empathy is really what we're talking about, then the need to be present, emotionally present, and seriously focused on the patient makes all the difference. And I think that's being addressed in this session, which is really important. Thanks.
Yeah. Yes, ma'am.
Do you use any EMR system that you go in to help an office with, or do you work with just one EMR?
I work with one or two, Practice Fusion and Curio, mainly because of their ease of use and ease of adoption.
Absolutely. Because if you take, and that's not the most popular out there, if you take any other EMR, you're talking about a week of instruction. So, you're working on the premise that the the practice is going to be accepting of
The
that
practice
one.
usually contacts me because of those platforms, because they've used all meds, they've used Epic, they've used GE, they've used Centricity, they've used Mysis, which merged with somebody else. They've paid the money and they're out of money, and Practice Fusion and Carrier are both free platforms.
Right.
But in addition, whatever they can't get from those programs, I go out and I find solutions from other industries. One of my favorite solutions is an app called DataDroid that allows, front office and back office people to enter data. It actually comes from the construction industry. But construction has refined it to the point where it's extremely usable and extremely adaptable. I think you had another question. Yes, no, maybe?
Oh, I was just going to say that your works very well in the we have a trainer for Epic who he's thinking of when you're surgery department in our practice room, and he loves it because he's role that you need to that your approach is very so I appreciate it.
Thank you. One of my favorite quotes is actually from The Hitchhiker's Guide to the Universe. If there's anything bigger than my ego in this room, I want it shot. All right. Thank you very much.
All right.